Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we are releasing a special bonus episode with what might be an opportunity for you or for someone you know, a chance for a full scholarship to the Johns Hopkins Bloomberg School of Public Health. The program is called the Bloomberg Fellows Program, and it's part of the Bloomberg American Health Initiative. You may be eligible to apply if you work in the United States now on one of these issues: addiction and overdose, adolescent health, environmental challenges, obesity in the food system, or violence. The deadline to apply for the program is December 1st. Learn more at americanhealth.jhu.edu. That's americanhealth.jhu.edu. In this episode, Shannon Jones speaks with fellowship graduate Maya Gibbons, current fellow Thaddeus Pham of the Hawaii Department of Health, and Sarah Lester, director of the Maplewood Memorial Library in New Jersey. They speak about opportunities and experiences with the fellowship program. Let's listen.
Faria, I'd like to start out with you. In your role as the fellowship officer, you have the opportunity to connect with many prospective applicants. What is that one question that comes up all the time?
Well, Shannon, there are a lot of questions that come up when I talk with prospective applicants. But one thing that comes to mind that almost everyone asks about is, am I eligible? Is the work that I'm doing related to public health? Would you want somebody like me? I'm not exactly working for a health department. I'm a lawyer. I'm a dentist. I'm a librarian. And Shannon, I always tell people that we have over 150 fellows across 40 states who are coming from really diverse backgrounds, from engineers to school teachers to nurses to midwives to librarians. We have a huge variety of fellows that are working not only in the realm of traditional public health from public health departments, but also working as school teachers and librarians. The fellowship program is looking for people who are non-traditional. We don't want everyone to come from a public health department. We want people to come from very diverse backgrounds. And so if you're doing non-traditional work and it's focusing on either addiction and overdose or violence or adolescent health or obesity and the food system or environmental challenges, we want to hear your story. And so I really try to make a strong emphasis to all of our prospective applicants that, look, please don't say that you are not eligible for the program. Tell us about the work that you're doing in one of those 5 focus areas. So it's very much open really to almost anything.
Another unique thing about the Bloomberg Fellows Program is that it offers prospective applicants the opportunity to apply in part with the organization in which they work for. Faria, can you tell us a little bit about this service obligation and the value that it brings to the organization and the program?
Yes, absolutely, Shannon. So when fellows apply to the fellowship, their organization has also to complete the application form to talk about the applicant and their strengths and what they envision them doing once they complete the MPH program. And let me talk a little bit about the service obligation, which is a very unique aspect of the Bloomberg Fellows program. So once a fellow completes their MPH degree, they have to fulfill the service obligation. And this means they would work for their collaborating organization for at least 1 year following graduation. And this is an excellent opportunity for both the fellow and the organization to benefit. Once a fellow begins their service obligation, they can really apply the skills and knowledge that they learned through the MPH program in real time in their actual jobs. And that could be research skills, data analysis skills. I mean, it could be any number of things because they get a very well-rounded education here in the MPH program, so that they would be able to really apply what they're learning to their actual jobs, which of course benefits the organizations because they get a staff member who has advanced knowledge and skills to bring back to the organization.
Thanks, Faria. That is a perfect transition to you, Shane. Shane, you work directly with collaborating organizations. Can you tell us about the role of the organization and the value of joining this national network of organizations?
So we currently have organizations all over the country. As Faria mentioned, nonprofit, governmental, non-governmental organizations. And this network is bringing all of those players together who are working on a variety of issues in their particular community and providing opportunities for collaboration, sharing best practices, networking, and working with faculty or other fellows through the initiative. Now, what we're particularly interested and excited about through this network is we're bringing together both your traditional and non-traditional public health groups and individuals. So this might mean, as we'll hear about later today, or in just a few minutes actually, our colleagues who are with the library system. How is it that they are working on the front lines of public health, and how can we partner and share their resources and best practices with other organizations across the country? So it's a mutually beneficial opportunity. It's talking about ways to connect the organizations, fellows, and faculty in the school together. It's not just the fellows getting an educational opportunity or thinking about ways to get another master's degree. It's really about building this network and finding ways for collaboration.
That's right, Shane. It's as much for the organizations as it is for the fellows.
At Baltimore Youth Empowered Society Drop-In Center, Bloomberg Fellow graduate Maya Gibbons sees the plight of youth homelessness every day. Maya works as the Data and Evaluation Specialist. Through her work, Maya is devoted to addressing how unstable housing can seriously impact health. Faria sat down with Maya to talk about her experience during the fellowship program and how she's applying the skills that she's learned to her organization.
Hi, Maya. It's so great to have you here. Thank you so much for joining me for this podcast.
Hi, Faria. Thanks for having me. I'm so excited for the opportunity to chat with you.
Oh, I love chatting with you, Maya. I'm glad you're here. So listen, I thought our listeners here would probably like to learn a little bit about you, your organization, and the work that you're doing for them.
Yeah. So I actually just wrapped up the fellowship. I graduated from my MPH. I was a full-time MPH student when I did the fellowship. I graduated a year ago. So this past year, I've been back with my host organization, which is the Youth Empowered Society Drop-In Center. And they are a homeless services agency that serves youth ages 14 to 25 through a range of services, including meeting their basic needs, providing case management, mental health support, and they run a small housing program. So my role post-graduate degree has been to be their data and evaluation specialist, and I am helping them create a framework for measuring programmatic outputs and outcomes and evaluating how well some of their programs are functioning, in particular the housing program.
Okay, so Maya, how long have you been with your organization?
I started out at my organization as an AmeriCorps Vista in 2014 when I graduated as an undergrad. And then I stayed on with them and became their workforce development coordinator. And did that for a few years. I actually left the organization and worked at a school for about a year, but then went back to the organization right before getting my MPH. And so that was when I got really involved in the housing program, and was a really great transition into the work that I did as a student and now I'm doing as a fellow.
Okay, great. Maya, you graduated, you completed the service obligation for the Bloomberg Fellows program, and it would be interesting, I think, for our listeners to learn a little bit how you applied the skills that you learned from your courses, your practicum, your capstone. How did you apply some of that knowledge and those skills to the work that you're doing?
Yeah, that's a really great question. I feel like the whole experience, there was a lot of continuity for me. My practicum involved working at YES, the Drop-In Center, to help them figure out how they could better put client voice into their evaluation efforts. So for the practicum, I designed and facilitated some focus groups, and that led to an annual client feedback survey that we still use. And then for my capstone, I sort of use that as a jumping off point to do a really youth involved evaluation of the rapid rehousing program. And both of those projects, the youth feedback project and the evaluation, are things that I've continued during my service year. And I think what was so valuable about getting the graduate degree and being able to do it in partnership is it really just took my hard skills to the next level. And it also gave me language to be able to translate the work that we were doing in the social services sector to a public health audience, where there are more opportunities for collaboration, potential funding, and I think just an overall framework that I really agree with. And so I feel like my time as a student just elevated kind of what I'm able to do now in my professional career.
That's so great to hear, Maya. I know as a student, you took several courses to complete your MPH degree. If you could choose like one or two courses, Maya, that you really were able to utilize those skills in the work that you're doing, whether it was, data analysis skills or research, whatever, what would you select? I know that's probably a hard question because there are so many interesting courses, but if you could pick one or two, what would you say were your favorites in terms of helping you do your job in a way that you weren't able to do prior to completing the degree?
Yeah, that is an exceptionally hard question because so many of the courses were valuable. But one that immediately comes to mind is I took Fundamentals of Program Evaluation with Kristen Mari, and who's one of the adolescent health leads. Mm-hmm. And some of the coursework I did in that, I used my host organization as an example, and I reference that course on a regular basis in the work that I'm doing now. Even the other day, I was looking at some PowerPoints from that course. So that course just gave me some real tools to be able to craft the kind of evaluations that the organization wasn't utilizing previously. Mm-hmm. And then a course that I think about often, I don't know that I reference it on a regular basis in work, but I took Understanding and Preventing Violence with another Bloomberg professor, Professor Dr. Webster. Mm-hmm. And that course, a lot of the theory and policy in that course felt really relevant to the work that's happening at YES and some of the issues that we're seeing. And I think as I write, I've been doing some writing recently for YES around recommending some youth-specific policies. And I've thought about frameworks from that class in the way that I write and communicate policies. So that was another class that felt really significant to me.
Wow, that's excellent. And if Dr. Mari and Dr. Webster were listening to this, they would be absolutely thrilled.
Yeah.
you're really able to apply what you learned in their classes to your actual work. Those are great examples, Maya. A lot of our listeners now are thinking about applying to the fellowship program. As a graduate, what piece of advice would you give someone who is thinking about applying this coming application cycle?
Well, I would first off say if they're thinking about it, they should do it because it's such a beneficial program. I think it's when else do you really have the opportunity to directly apply your education to your work? I mean, that's the ideal in any master's program, but this felt much more tangible. And even when I talked to peers from my MPH program who weren't in this fellowship, I think a lot of them have struggled a little bit to find some of the direct lines between the work they want to be doing and their education. So it's just a great way to support that. Mm-hmm. I would say for people thinking about applying, when they come in, being open to the idea that what they're going to learn may be a little bit different than what they are going to expect. I think I had a pretty clear idea about coming in from the social services sector and focusing a lot on policy, which I did get the opportunity to focus on. But the year I was a student, I really learned that I love data, and I loved some of my analytical courses were my favorite courses that I took. Mm-hmm. And so partway through the year, I just kind of pivoted my focus a little bit, and those skills have served me so well this year in my workspace. And they're not necessarily ones I would have guessed would be the ones that I would use so much right now.
Mm-hmm. That's great advice, Maya. I appreciate it. And I'm sure people who are thinking about applying and listening to you also appreciate this advice coming from someone who has gone through the program and completed the service obligation and continues to apply the skills and knowledge learned from the fellowship program.
Years ago, when Thaddeus Pham read Joan Didion's essay collection, The White Album, for the first time, he was struck by the opening line, "We tell ourselves stories in order to live." Now, as the Viral Hepatitis Prevention Coordinator for the Hawaii Department of Health's Harm Reduction Services branch and the co-founder and co-director of the Hep-Free Hawaii Coalition, Thaddeus is using the power of public health to shape the narratives of those impacted by his work.
So I'm the Viral Hepatitis Prevention Coordinator, and I work in the Harm Reduction Services branch. So really what we do is we use infectious disease as a jumping off point to address larger social justice issues. So it's very exciting work. We're always looking intersectionally and really seeing how hepatitis relates to other issues like housing and mental health and immigrant-migrant healthcare, pretty much everything. So, yeah.
Wow, that's terrific, Thaddeus. You are one of our part-time fellows, and I think it would be helpful for our audience to know, how do you balance working full-time and taking your MPH course load? Can you tell us a little bit about that, please?
Yeah, I think it's been a really great experience because the part-time program has allowed for a lot more flexibility. And I think that's something that I've kind of learned in the short time since I've started is just to be really intentional about my time. So there's time when I'm doing work and there's time when I'm doing school. And then there's also time when I'm not doing either one of those. And I really just make sure that when I'm focused on one of those things, then that's what I'm doing. So it's been really helpful.
Okay, that's great to hear that it's been so flexible for your needs. Thaddeus, you have been taking courses for a while now, and I wonder if you've been able to apply any of the skills and knowledge that you've been learning in your coursework to your actual job.
Yeah, actually, it's been really helpful. I've been doing public health for about 10 years, but I've never was formally trained. So the school has provided me kind of a great way to conceptualize the work, and it's given me the language and skills to to really enhance the work that we're doing in Hawaii.
Mm-hmm.
I'll also add that I started my practicum project, so that has
terrific.
really, allowed me to get in there and to really work more directly with our community agencies and our community partners.
Mm-hmm.
And I've learned so much just by taking that time to sit with folks and to talk with folks and to really see what service provision is like in our different agencies.
Oh, that's fantastic. It's great to hear you've already started your practicum. Good for you, Thaddeus. Thank you so much.
Yeah.
Emily is the teen librarian at the Maplewood Memorial Library in Maplewood, New Jersey. Working closely with middle and high schools and other local youth organizations, Emily serves young people, providing books and resources, programs, and a safe after-school space for teens to gather. Sarah Lester, the director of the Maplewood Memorial Library, is Emily's collaborating organization contact.
I'm the director of the library, and I have the privilege of working with a group of, more than 30 really incredible people, including Emily. And when we saw this opportunity, that was advertised through the state library, an opportunity to get involved with the Bloomberg Fellowship Program, we thought it was an immediate connection for us because so much of what we do is public health related.
Sarah, can you just tell us a little bit about what, as a contact or as a collaborating organization, what your experience has been like so far?
I think it's been overwhelmingly positive, and I can start with just having Emily go, taking classes, coming back to talk to me and to our colleagues, being really inspired and engaged, and bringing back wonderful ideas to share with us and ways to improve our services. To also being part of the summit, and that was so inspiring for me to be surrounded by so many really kind of leaders in their fields, and really gave me lots of different ideas and thoughts of ways that we could improve things at our library, and also how we could use our library as a model for other libraries across the state. As I understand it, Emily is the first librarian to be part of this program. So it really is, a new connection that has been made here. And so we are looking at ways that we can share this with other libraries on a national level.
Absolutely. And we are grateful for your partnership and for you all to, see the opportunity and take a hold of it. You talked about this a little bit with Emily taking courses and sharing that learning with you all. But are there any other benefits of having a colleague be a Bloomberg Fellow that you would like to share with the listeners?
Well, I think, Emily's focus area is on adolescent health, but I think all of the 5 focus areas touch us at the library. So I think, we've, just being exposed to sort of the learning involved in all of those areas has been really, really helpful for us.
Thank you again so much for sharing your feedback and to sharing this information with our listeners. Faria, I think that people are anxiously waiting to hear how they can become a part of this amazing work and how they can apply.
Yes, and I'm excited to tell them. So I'm going to talk a little bit about how to apply to the fellowship. So applicants would need to apply to both the MPH program and the fellowship together at the same time. And for the MPH program, you would start by going to their website. They have very explicit instructions on how to apply to the MPH. You have to submit all of your admissions materials through SOFIS, which is the name of the application processing system that the Bloomberg School uses. So all of your transcripts, your letters, essay, everything will be submitted through SOFIS. And at the same time, you would go to the fellowship website and you would download our 2 fellowship application forms. There's one for the applicant and one for the organization. And both of those forms must be completed and also submitted right on our website. So you would do both the MPH and the fellowship application at the same time. And I want to tell everyone that the final deadline to submit both your MPH admissions materials and your fellowship application forms will be December 1st. And so all of your materials, they have to be submitted by then.
I'm a Bloomberg Fellow. And I'm a Bloomberg Fellow.
I am a Bloomberg Fellow.
I'm a Bloomberg Fellow.
I'm a Bloomberg Fellow.
And I'm a Bloomberg Fellow.
Historian and preservationist.
Detective with the Threat Response Unit.
Director of Suicide Prevention.
I became a fellow to make sure addiction is seen as a disease.
I hope to do my part in ending youth homelessness.
I became a fellow to find new ways to address the effects of vacancy and abandonment.
I hope to reshape the food system to promote community and ecological health.
I became a fellow to strengthen primary prevention of human trafficking.
Join us.
Join us
as we work to save lives and build a healthier future for our country.
And build a healthier future for our country.
Applications are now available for the 2021 class of Bloomberg Fellows.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.